When bone breaks, it's going to heal whether you seek a medical attention or not. What am I trying to say is that the bone is going to heal whether it is managed by orthopedic technologist or technician, or it is not managed at all. So I'm just going to be talking about the reasons why people, the complications of not getting it managed by technologists or a technician. Because some people be like, okay, since this fracture can heal whether it is managed or managed, so why am I stressing myself? If it is not managed, it's going to heal, and if it is managed, it's going to heal. But there are some complications as to the fact that you don't seek medical attention when your bone is broken. Now, the first thing is that when a fracture breaks, we say fracture is the break in the continuity. That is, the fracture discontinued the process of that bones. So the bone continuity has been stopped. So the shape of the bone will be deformed. It's not going to be the same way the brain has registered that particular bone. So when fracture happens, it's going to, the fracture may be displaced or not. Even if it is not displaced, the fracture must have the bone must have left the original shape. So when it is displaced like that, it will be deformed. The shape will be different. Now, where the management comes in, what we do when we say we want to manage the fracture conservatively is by manipulative reduction. That is, we manipulate with our hand. We pull, then the body of the patient will serve as the counterpull, and the bone, the shape of the bone will be brought back to the normal anatomy. Because before the fracture happens, the bone was in an initial state of anatomy. That is how the brain has registered it. So when the fracture happens, the normal anatomy has been deformed from there. So what we do is to bring back the normal anatomy, and we do it until healing is confirmed. That is why we have to put the concept of circular POP cast so as to immobilize that particular bone. Now, when the bone is not managed, the first thing is that the shape of the fracture, the bone will heal exactly to that shape. So if the bone is bent like this, that is how the bone will be healed, and that's how the patient will continue to use it. So there are people that will be bending while walking. They may not be bending like that before, but after sustaining fractures, they are walking like that. That should not be because of the management of orthopedic technologists or technicians. Mismanagement can cause it or neglected fracture. So when we talk about neglected fracture is when you don't seek medical attention on time, or you don't even go for medical attention at all. So that's what we call neglected fracture. So one of the complications that can come when you don't seek medical attention in a broken bone, although it's going to heal, one of it is what we call malunion. What are we talking about? We say malunion. Malunion is when